How well do you know your own health? Have you stopped to think about this question? Looking at all of you here, I believe most of you have learned a lot in your learning years, like mathematics, science, and literature. But have you asked yourself questions on how well you know about health knowledge, about medical literacy, how to treat common diseases, how to do first aids, what do some medications mean, which health myths are too good to be true? If you can confidently say yes to those questions, then that's great. But if you say not much, then you are not alone. In reality, there are still people out there who don't have the knowledge for medical literacy. Medical literacy is usually taught in advanced studies, and they are not well accessible to schools. So there are still people who don't have this precious knowledge. Medical literacy is also often buried in complicated words, which causes difficulty for many people to even understand it. Now, these are problems, and they cause a gap in health literacy that cannot be ignored. Good afternoon, everyone. I'm Andrew, a student from SWA. I'm not a doctor, I'm not a scientist, and I don't have a PhD in medicine. But I do know that bridging the gap in health literacy is a crucial step towards building a healthier and stronger future for everyone. I believe every person in the world should have enough knowledge on the basics of medical literacy. We, as everyone, should know how nutrition affects our body, about medications, about vaccinations, and also about first aids to others. And just like the importance of filtering fake news from the internet, people should also be able to fact-check medical information, putting them aside from dangerous health myths. Now, some people in the world, maybe you, know a lot about health, that identifying problems in your own body is not a problem anymore. But there are still people who don't have this ability, including some of our loved ones. Do you have a loved one who suffers from health conditions? Or maybe you yourself have? Well, I myself am no stranger to this. Meet my grandma. She's 76 years old. She's still alive, but not in good health. Around 5 years ago, her hands started trembling. We thought it was just due to aging and stress, and assured ourselves that her trembling would be gone in a few days. So, we ignored signs of her trembling for months to years. We thought it was just something we didn't have to worry about. But her trembling wouldn't stop. It got even worse. It got to the point where she can't even eat or drink properly. So we finally decided to check her to the hospital. And we had no choice but to swallow the bitter truth. She had been diagnosed with Parkinson's. At first, we didn't fully understand what this meant. We only knew that her hands would stop shaking. But as time passes on, we finally realized that Parkinson's is way more than just tremors. It's a disease that deteriorates your brain, impairs your movements, and possibly even causing dementia and anosmia. Up until now, there is still no cure, but there are treatments that can help to ease the symptoms. But in my grandma's case, her disease had progressed quite a lot, that she is not what she used to be anymore. A woman who was cook for the whole family was now struggling just to hold a spoon. And treating her disease now became more difficult, more expensive, more invasive. If only I could have known it earlier, she could have undergone easier therapies that can help slow down the disease with less pain. But it's too late now. All of this is because of my lack of medical literacy. I ignored any signs of her disease until it had gone too far. Unfortunately, my family's experience is not unique. Limited medical literacy doesn't just affect individuals, it impacts the entire population. Around the world, there are countless countries with high death rates simply because people don't know enough about health. And many of those cases could even have been prevented. Let's start from Indonesia, for example. In 2019, several people in one rural area of Indonesia have limited medical literacy. Around 19% of them have inadequate health knowledge, with 44% of them in the problematic level. Now, that's like already more than half of the people there. And that's just one rural area. Imagine how big the problem would be if we discuss the whole country. But why does this matter? Well, limited medical literacy has a lot of impacts to us. And one of them is life expectancy. Indonesia's life expectancy reaches up to 68 years. Now, compared to other countries like Singapore, and they can reach up to 83 years. Just imagine that you can have 15 years of your life to do the things that you desire, to spend time with your loved ones, to create memories. That's the kind of difference that we are talking about. But we are not just talking about numbers. We are talking about lives. Limited medical literacy causes deaths, preventable deaths. For instance, 6,000 newborn babies die every year in Indonesia, in which their sickness can be treated with an increase in medical specialists. Many people have to carry their ill babies overseas just to find the medical service they need, which is often absent in Indonesia. Not just ill babies, but also ill relatives of all ages. In fact, my family had experienced this too. My uncle had to carry his father all the way to Singapore just for him to find a doctor. A really painstaking effort to do. In the end, his efforts are all in vain. But imagine how different things could have been if there was already enough medical attention in Indonesia. All of this roots down to the lack of medical literacy. Another point to mention is that medical literacy leads to the making of dangerous health misconceptions about medications, treatments, and diets. Many people have created false health myths due to the wrong beliefs and limited medical literacy. And to other people, this can lead to risky decisions and deadly consequences. Out of all the myths I've seen in my whole life, I've found one that is truly shocking. But before I reveal to you this myth, let me ask you guys a question. Who among you here has drunk bleach at least once in your life? No one? Good. But if you raise your hands, I have some serious questions for you. The myth was suggested that drinking bleach can treat all sorts of health problems. People believe it can fix kidney failure, remove Parkinson's, reduce asthma, and even get rid of Alzheimer's. This is really absurd. Bleach can burn your mouth and throat and can cause severe breathing problems. And there's no evidence to back up this myth. So it's very, very concerning to hear that people might fall for myths like this. Believing in them can lead to serious health injuries, long-term health problems, and even death. And there's still countless myths out there pulling the internet, spreading misinformation. All of this has shown to us how limited medical literacy affects to us, to communities, and to one's nation. So, what should we do? How do we address this lack of medical literacy? Plenty of organizations are already working to improve health education, and so can we. Usually, limited health literacy tends to correlate with limited education. As we all know from earlier, medical literacy is usually taught in higher educations and is fully loaded with complicated words. So to solve this problem, we must make health information easier to access. Let's start small. We can do that through words of mouth. Start from yourselves and spread any health information that you know to your friends and to your relatives. We don't have to be doctors or experts to help. Just by sharing bits of health information, we are essentially improving everyone's medical literacy. Another approach is to volunteer yourself to teach people in rural areas about health. Now, who can volunteer? It could be anyone: professors, doctors, nurses, teachers, and even students. It can be anyone literally, as long as they know about medical knowledge. In fact, I joined a school club that focused on boosting everyone's medical literacy. Recently, we went to a local school, taught students there about health, and donated first aid kits to them. We taught them how to utilize the first aid, so if someone gets severely injured, at least the students there can quickly take action to save their life. This is one example of volunteering to share this precious knowledge to communities that need it most. Not just by written words, but by teaching other people about medical literacy, we are essentially spreading this precious knowledge to more people around the world directly. Last but not least, we are in an ever-evolving world with technologies that developing at such a rapid pace. Why not use social media as a tool to spread health knowledge to the public? While it won't reach every corner of the world, social media is still a very effective tool, and literally everyone can take part in this. Maybe just a single post can help someone learn more about health and even save a life. Well, as long as the information you shared is valid. But there are in fact more ways and efforts that we can take to spread medical literacy. All we need is the initiative to do so. If we can help more people understand about health, they can see earlier diagnosed, have better treatments, and have fewer preventable deaths. Mortality rates could drop, and countries could even see improvements in their overall quality of life. Just think about the Netherlands, for example. They have good medical quality with good medical literacy, and data suggests that their mortality rates are low. Our country and several other countries in the world still have some room for improvements, but by taking small steps, we can improve it bit by bit. On a personal level, families will be better at preventing losses and caring their relatives more. Just think about it. If you know more about health, you can treat your loved ones better, caring for them better during sick times, and making better decisions for their health. Lastly, when it comes to misinformation, an increase in medical literacy means that people will be better equipped to spot false health myths. And maybe no one will follow that bleached myth anymore. And with that increase, people can give better health tips for everyone. I believe medical literacy is a right, not a privilege. Before I end, I would like you guys to take something from my speech. It is a quote from Martin Luther King as he expressed his inequality and gap in medical literacy in a way that I couldn't agree more. Out of all the forms of inequality, injustice in health is the most shocking and inhumane. Thank you.